El objetivo fundamental es intercambiar conocimientos, haciendo venir a Alicante, invitando a los líderes más importantes en dos temas que nos preocupan muchísimo. Uno es el por qué unas mujeres tienen una menor reserva ovárica y por tanto por qué van a tener una merma en su expectativa fértil, y en segundo lugar contestar a la pregunta que muchas veces no tenemos respuesta de por qué no me quedo embarazada después de haber intentado con tratamientos, o me he quedado y lo he perdido.
Nuestro grupo de estudios son fisiosómico, cariotipos, estudios genéticos de fibrosis quística.
Influyen de forma fundamental, pero que la reserva ovárica de nuestra probable sexualmente.
Get back, live happily to age of 100 years. That's the big purpose.
Sure. I talked about the major advancements in modern genetics, coming from very large-scale studies in large collections of human samples, with new technology applied, allowing us to interrogate the whole human genome now. And from that research, many new discoveries have arisen, in this case in the field of age at menopause and age at menarche. So we now have dozens of genetic factors which are associated with age at menopause and age at menarche. Can we use this? At the moment it's just telling us a lot about the biology, underlying biology, and it cannot be used at the moment for predicting when a woman will reach menopause or when menarche will start. But we're getting there. We're scratching the surface of all the genetic factors that are there.
It might be to do with post-sampling processing or pre-analytical instability of the samples.
Okay. So I've been asked to talk about assessment of ovarian function. Ovarian function is the main determinant of success in IVF, and we have got a number of markers for ovarian function. And what we use these days are indirect measurements of ovarian reserve.
So that we can show that okay, your anabolic count is this, and therefore, based on our data, this is what the life of both poor response and excessive ovarian response. So here there's an example here for a 30-year-old.
Family life as we knew it, and it would render women even more wicked than they were already, and it was a thorough.
At this talk that organised by the Instituto Bernabeu, I shall be talking about the impact that egg freezing will be having on the opportunity for young women to optimise their lives. At the moment, we know that a lot of young women are deferring and delaying starting a family because they have career and educational goals to achieve first. But unfortunately, a significant proportion of these young women will discover that it's either impossible or at least very difficult to achieve a pregnancy when they want to.
Reduction with an odds ratio of 0.79 in life.
My presentation was addressing the benefits of androgens to follicle maturation and why androgen supplementation works and why it benefits women with low ovarian reserve in trying to get pregnant.
Well, poor ovarian responders is one of the most difficult group of patients that we have in everyday IVF clinic. This is the truth, and all clinicians always have a problem in treating these patients. What we've seen from the current trials is that the pregnancy rates are really low in this population, and novel treatment options may have the potential to alter the prognosis, but first of all, I think that we need to define this population. By using the recent definition developed by the ESTRE, by the European Society of Human Reproduction Embryology, And by conducting methodologically correct and proper randomized trials, I think it's the only option to find a better outcome for these patients and find a solution, if there is any in the end. For this, again, I say very, very difficult group of patients.
I was asked to talk about implantation failure, having undergone IVF and ICSI therapies due to uterine causes. And I talked about the removal of septated uterus, of the removal of fibroids when some transfers did fail. And I was talking about endometriosis and its special form, adenomyosis, which might impair pregnancy rates in IVF ICSI cycles.
Each natural killer cell to this. It comprises 10% of all peripheral lymphocytes, and the normal range ranges from about 5 to 30%. The most abundant type of lymphocytes in the endometrium is natural killer cells, almost comprising 70% of the cells there. And definitively.
Recuerdo el nombre de esta charla, que es el Maturation en endometrios, y empezamos a analizar, si ya habíamos analizado básicamente el ciclo natural, comenzamos a analizar los ciclos estimulados. ¿Por qué? Se comenzaron a hacer estudios que solamente voy a nombrar.
I will be talking about the role of ultrasound in reproductive medicine. Of course, today many special points that determine the success of reproductive medicine can be explored by ultrasound. So my presentation will focus on the role of ultrasound in exploring the endometrial and myometrial function. Measurement itself. So we could at that time also develop more objective software to calculate the frequency of the uterine contraction. So we had this.
Si pudiéramos seleccionar o seleccionando